I'm happy to be here to chat a little bit about, Medicare with Scott Dardick, kind of what it is, where it fits into your life, and just how to think about it as you move through various stages of life. My name is Brad Newman. I'm one of the advisors here at Fort Pitt Capital Group, and with me today is Scott Dardick with Alera, and Scott's going to talk to us about the ins and outs of Medicare planning. Before we jump in, I just want to say on behalf of the entire firm here at Fort Pitt Capital Group, we're really happy to be able to present this whole series of webinars. And for those of you not familiar with Fort Pitt, we are an investment management and financial planning firm that was founded in 1995. Just a couple things that I think make us unique. Number one, we do make all of our investment decisions and do all of our planning in-house. We really buck the industry trends by not farming it out to a third party. So, we're the folks actually making the decisions and pushing the buttons and pulling the levers. I think second, we use, really a team approach to provide all of our clients with, a boutique feel, to what we do. And I think third, we really take a holistic approach to every relationship. So while people really, I think, come to us predominantly to have us manage their portfolios, we're working with them in all facets of their financial life, areas that we've got the internal expertise in, things like Social Security planning and things that we're going to be working with your attorneys and accountants and other advisors on, like charitable giving and intergenerational giving and things of that nature. And for those of you not familiar with our webinars, they really are designed to be first and foremost educational and really just touch on all the areas of your life that are important financially. And today we're one of the ones that we're leveraging the expertise of some of the folks that really know more about the topic than we do. So I'll just take a brief minute and we'll get ourselves introduced. Like I said, I'm Brad Newman. Just by way of background, I'm a certified financial planner with Fort Pitt. I've been working with clients for over 25 years to help them quantify and meet their financial goals. I'm one of the advisors here in our Central Pennsylvania office in Harrisburg. Married with 2 kids. One just graduated college in the spring, and the other is a senior. So I've got a little bit of light at the end of the tunnel. And Scott, I don't know, would you take a minute just to introduce yourself?
Sure. Yeah. Again, my name's Scott Dardick. I'm with the Alera Group. I've been with them since 2014. Before that, I've owned various businesses. My wife's an eye doctor, helped manage her practice. That's my first introduction to insurance, really was through that, but her side of the fence, not this side of the fence. Understand they work with it. And when I first got into the business, I worked with my father, who started when Medicare Advantage plans first came out in 2006, and he worked just for Humana. So I did 1 year with just one carrier, and after a year, I realized we're not doing this right, because it's not a one-size-fits-all. It's truly to really help people. You need to have the entire marketplace, have all the carriers, and help people sit down and understand, because it's very complicated. I have two kids. I have one just finished law school, and the other one is going to med school next year. So yeah, so very busy with that.
That's awesome. Well, that being said, let's just touch on a couple of maybe housekeeping items as far as how to interact. If you're on a mobile device, at the bottom, you can tap your screen to ask questions or download the handout. If you happen to be on a computer, here you can see where you can both ask questions and get the handout off to the left-hand side. Slides might lag a little bit. Oh, there we go. And with that being said, I will just say we're probably going to address the questions at the end of Scott's our conversation. If you happen to see us looking down, we're probably getting some of the questions on our phones or ones that have been pre-submitted, so we're not trying to multitask. But with that being said, let's kind of jump in. Scott, would you mind maybe just at a base level reviewing some of the Medicare basics? Just a brief history of Medicare, kind of how we got to where the program is today.
Sure. So Medicare started in 1965. That's when the law was passed. It actually went into effect in 1966. It comes in two parts, Part A and Part B, which I'll explain more in detail later. It's funded by taxes people pay while working. So that's how Medicare is funded. So it's just basically a health insurance program that was enacted back in 1966, as I said. So this program is just going to be understand the basics, the general parts to Medicare. When can you enroll? What's covered? What options you have, which can get very confusing, and especially when can you enroll and those type of topics. So, oh, I'm sorry. I got it. So going back to what Medicare I said comes in two parts. So Part A, if anyone hasn't seen a card, is labeled hospital on your card, but it's a little misleading because it only covers room and board of a hospital. It's not paying the doctors that treat you. It's just your operating room costs, your room costs. Part A also covers skilled nursing or rehab. It's only a maximum of 100 days. Medicare does not cover long-term care. That's a separate insurance you'd need to get if you wanted that. It's only, you have to be improving each day or Medicare will kick you out. It'll also cover some inpatient mental health care, some blood transfusions, and hospice care. Part A, if you've worked for 10 years or 40 quarters, you and or a spouse, if you have enough credits or quarters, there's no premium for Part A. If you don't have that, there is a premium for Part A. It starts at $505 a month, but most people have the work quarters in, so you're not paying a premium for Part A. Part B, the other original part to Medicare, that's covering everyone else, doctors, labs, ambulance, durable medical equipment like wheelchairs, crutches, oxygen, so forth. That there is a premium for that. The premium you pay for that is based on your income. And this is the chart for 2023. It is going to change next year. We won't know what that is at the end of this month. At the end of the government's fiscal year is usually when we know what the new rates are going to be for next year. But if you look in that top section, the green section where it says individuals, if you have a modified adjusted gross income or household income of $97,000 a year or less, if you're married, it's double, $194,000 a year or less, you'll pay $164.90 a month. That is your starting cost to Medicare. So you're paying this no matter what else you add to Medicare. This is your starting cost. Now, as you can see in this chart, if you earn more than those amounts, and I won't go through them all, but there's 5 different levels or ranges of income, you pay not only more for Part B, but you also pay more for Part D, prescription drug coverage, which I'll cover more detail later. So they're going to tack that amount on top of whatever premium you have for your drug plan. So this is, as I said, the starting cost. What Medicare does when you first enroll into Medicare, they're going to do a 2-year look back. So right now they're looking at, if you're going to enroll into Medicare this year, they're going to be checking your income from 2021. That's going to determine what rate you'll be paying at. Now, obviously this is fluid. Your income can go up or down over time. It is appealable. So if I was going to apply for Medicare right now and say my income in 2021 was at one of the higher ranges, but my income for 2022 was lower, as long as I have a tax return to show, I can file an appeal and try to get that lowered from Medicare. So I'm not paying that high.
I was just going to ask about that, Scott. And are they typically successful when you go through that process?
Yes, as long as you have a tax return. You can't just say, hey, I'm retired, now I'm going to make less money. You've got to demonstrate it. But if the opposite happens, let them find that your income went up. I just don't you have to volunteer that. They'll find it, but sometimes there's a delay in that. But yeah, it is appealable.
And I assume it's the same thing if you have a 1-year spike in income for some reason, that you obviously have to pay the higher premium after that spike, but then you're able to not have that count against you going forward.
Exactly. You absolutely can. Yep.
Okay. Perfect.
And if you're drawing Social Security, they're going to deduct this month out of this amount out of your monthly Social Security check. If you're not drawing Social Security, you have to pay this quarterly. They're going to do this times 3 until you start drawing.
Okay. So let's talk a little bit about enrollment. That seems to be a really common question. I know we got several pre-submitted questions about enrollment. You know, how does it work? When? What are the ramifications if I miss an enrollment deadline? Just can you talk about that a little bit?
Absolutely. This probably trips up more people than anything else. So let's start with, if you're first turning 65, I'm sorry, that's the age that you can enroll into Medicare normally. It's most people, when you first turn 65, Medicare gives you a 7-month window. They give you 3 months before the month of your birth, the month of your birth, and 3 months after. That's your window to enroll in Medicare. If you wait past that and you have no other coverage, which again I'll cover in a second, you can be penalized for getting Part B late. B as in boy. You can get a penalty for that. So you should enroll during that 7-month window. Medicare always becomes effective on the first day of the month. You cannot start Medicare in the middle of a month, and it's always the first day of the month of your 65th birthday. So if I'm, say born October 15th, my Medicare would start on October 1st. It's always the first of the month, unless someone happened to be born on the first of a month, then they'll actually backdate it a month prior to that. So if I was born October 1st, my Medicare would actually start on September 1st. So but other than that, it's always the first of a month. So
Interesting.
yeah, I know this adds to the confusion, but that's the window that people should enroll. Now, there's an exception to that, and this is happening more often today, where people want to continue working past 65, and they just say, well, do I have to sign up for Medicare or not? Well, the reason confusion is because both answers are true. Yes, some people do, and some people don't. If you work for a company, and here's the key, if that company has 20 or more employees, then the group plan is primary to Medicare. If you got Medicare, it'd be secondary, so you do not have to enroll into Medicare. So if I work for a company with more than 20 employees, I can stay on my group plan as long as I wish, and I get a special election when I leave Medicare, or excuse me, leave that company. I can pick up Medicare with no penalties. And again, you want to time it so your work coverage ends on the last day of a month, and Medicare is going to start on the first of the month, because you can't start in the middle. So if I retire on, say, October 10th, I have to know, does my coverage end on the 10th, the day I leave, or are they going to cover me for the rest of the month? Because you want either Medicare to start October 1st in that scenario, or November 1st if I'm covered. You want to time it for the beginning of a month. Now, if I
Right.
work for a company with less than 20 employees, then I have to enroll into Medicare when I'm turning 65, or during that 7-month window, or I will be penalized, because your group plan only has to take a secondary position to Medicare. Medicare is primary with less than 20 employees. So you must therefore enroll into Medicare in that case.
Okay. And Scott, there were a number of pre-submitted questions about just that. So that's perfect.
I
Is
say
just
this
out of
trips up
curiosity.
more people, because people say, oh, you got to sign up when you turn 65. Well, it depends again on the size of company you're working for. Some it's true for,
Yeah,
some it's not. And then sometimes the company insurance is maybe better or worse than Medicare. Maybe Medicare is better, cheaper. So it should be analyzed, but all your options. But yeah, that's a very big question.
and so just to clarify, if you're with the company with more than 20 employees, it's your option.
Correct.
Okay.
Correct. If you work for a company with less than 20 employees, you have no option. As a matter of fact, with less than 20 employees, companies can make you go onto Medicare and kick you off their plan if they want to. They have total control. They could cover it for one employee and not cover it for the other employee if they want to. They have freedom to do what they want with less than 20 employees. 20 or more, no, they have to offer you group coverage, and it's your choice whether you want to get Medicare or not.
Interesting. Well,
So you can,
along
oh,
those lines, and you mentioned Cobra, but can you just talk a little bit how Medicare interacts with things, like Cobra, like health savings accounts, like health retirement accounts, some of those types of benefits and
yeah,
some of those types of tools?
I'll be happy to go through that. If you don't mind, I want to cover one more point though on this slide.
Oh, okay.
People can get Medicare at any age if they qualify for a Social Security disability. So there are people younger than 65 on it. If you've had that disability for 24 months or 2 years, you'll also get a Medicare card. I just want to throw that out there too. But so yes, now I'll be happy to answer your question. So um, let's talk real quick about the late enrollment. So the late enrollment for Part B that you want to avoid, it's 10% or whatever your monthly premium is for each 12 months you went without Part B that you could have signed up for it. So going back to that chart, if I was on say in the first range, and I was on Medicare paying the $164.90, that's $16.49 tacked on for every 12-month period. So tacked on monthly. So that, and it never goes away. So it's for the rest of your life. And if the premium goes up under Medicare, your penalty goes up as well. So you definitely want to avoid those
Wait,
penalties.
say that again. So that penalty, even once you elect, you continue to pay that penalty?
Forever, never goes away. So
Wow.
if you miss that window, yeah, and if you're in the higher amount, and by the way, I didn't say all these are IRMAs, income related monthly adjustment amount. That's if you pay a higher range because of income, that's called IRMA. But whatever range you're in, as yes, and if that premium goes up each year, say I went to 170 next year, now I'm paying $17 a month extra. Goes up to 180, I'm paying $18 a month extra for the rest of your life. Never
And
goes
it
away.
goes up every year.
You can't, and typically the premiums go up every year, and you can never get out of it.
Wow.
Well, I shouldn't say that. You can get out of it if you qualify for low income or Medicaid or welfare, then they drop the penalty
Okay.
for you. But for most people, so yeah, you definitely want to avoid that late enrollment penalty.
Okay.
And since we're on the subject, let me bring this up too, because if I say I'm going to work on past age 65, I'm now 67, now I want to retire, now I'm looking to get Medicare. Medicare gives you an 8-month window to pick up Medicare before the penalty kicks in. So you want to make sure you enroll it if you stop working or you're no longer an active employee. So even if you take COBRA, which I'm going to come to in a second to answer your
Okay.
question, but you have 8 months to get Part B. Otherwise, that penalty is going to start after 8 months. So now coming to your question on
Well,
COBRA.
and Scott, just a quick question before that one. So
Yeah.
does the government communicate to you at all to say, this is coming up, you're now in that 3-month window before 65, or you're now, it's totally on
Totally up
you?
to you. Totally
Okay.
up to you. They may send you a Medicare and You handbook as you're approaching 65, and everything's in there, and they expect you to read and know everything in there. Again, most people do not, and this is what trips up a lot of people. So
Yeah.
a lot of confusion with that.
All right.
So I'm going to jump to a different slide here. I'm going to go to the COBRA slide since we brought that up, because this has become a real point of issue, especially of late. So if you have Medicare Part A or Part B and you become eligible for COBRA, if you have it, so I'm working for a company, I have Part A and or Part B, and I'm leaving work and they're offering me COBRA. The company has to offer me the COBRA if I'm with 20 or more employees. Now, typically COBRA is way expensive and you're better off going on a Medicare plan than doing it, but you have the option. But if you're in COBRA and now I become eligible for Medicare, I'm turning 64 or 65, and I'm been on COBRA, now I'm turning 65, I must enroll in Medicare because your COBRA coverage will end. And COBRA is always secondary to Medicare. So bottom line rule is if you're eligible for Medicare, get Medicare and do not go on COBRA. You can do better off on the marketplace what you're going to be paying in COBRA rates. But this has tripped up a lot of people because and I've had cases of this where people are on COBRA, they're past 65, they've been on COBRA. The company, the insurance company that they're with under COBRA realizes, oh, they're Medicare age. We're secondary. We only have to pay the part that Medicare doesn't pay for. Whether you have Medicare or not, they only have to take a secondary position. And now you're exposed to a lot of cost. 80% of all your doctors you now have to pay for.
Wow.
So you definitely want to make sure you get Medicare if you're Medicare eligible.
Okay. So there were a lot of other questions, Scott, that kind of went around Medigap supplements, Advantage plans, and most of them were, well, kind of what's the difference and what's the general landscape of that?
Yep. All right. Let me touch on that next here. Absolutely. So to address that, let me first go over what Medicare covers, because it's going to help make sense what those plans do if you understand what cost you're exposed to under Medicare. So
Okay.
Part A, as I said, is labeled hospital, but it only covers room and board. It has a $1,600 deductible. You have a limited number of days in the hospital. If I just had a Medicare card, I have to pay the $1,600 if I went to the hospital. The first 60 days are for room and board are no charge. But days 61 through 90, I have a $400 per day copay. If I'm in longer than 90 days, Medicare gives you 60 lifetime reserve days at $800 per day copay. Then again, that's just room and board. The doctors that are treating me are covered through Part B that I'm paying that premium for. It has a $226 annual deductible and a 20% coinsurance. So I'm paying 20% of my surgeon, my anesthesiologist, my family doctor coming to check on me. I'm paying 20% of all that. So if I had a $100,000 surgery, that's $20,000 I'm going to owe. And there's no maximum out of pocket or MOOP. There's no limit to my 20%. So because of that, most people will buy insurance to help protect them from what those costs are. And the different insurances that you have, as mentioned, I'm going to change slide, is the first choice is a Medicare supplement or Medigap plan. That goes back to 1965 when Medicare first started. And that was the only choice people had until 2006. In 2006, the government introduced two new things: Medicare Advantage, which is now Part C under Medicare, and prescription drugs, which is now Part D. So you now have 4 parts to Medicare. Original Medicare is A and B. Now we also have C and D as options. So these are the choices that you were just talking about, the differences. So let's start with the Medicare supplement or Medigap plan. So what these are, as I said, this goes back to when Medicare first started. These are plans that are designed by the federal government. So the federal government puts the benefits together. And unfortunately, like the government likes to do, they letter everything. So you have plan letters A through Plan N. Not to be confused with Part A or Part B. This is Plan A, Plan B, Plan D, and so forth. Sorry for the alphabet soup. The government likes to letter them. You'll see a whole bunch of letters missing because they've discontinued a bunch throughout the years, but each of these plan letters represents a design of how much that plan will cover of what Medicare made you pay for. So for example, Plan C and F, with F being that was at the most comprehensive or highest level. It covered everything in Medicare to make you pay for. It covered all the 20%, all the Part B deductible of $226, all the per days in a hospital. It covered everything. You didn't have a dime out of your pocket. But of course, you're paying a higher premium for that plan than, say, a Plan A where you still have all these deductibles. Well, they discontinued Plan C and Plan F for anyone turning 65 after January 1st, 2020. If you were 65 prior to January 1st, 2020, you can still buy a Plan C or Plan F if a carrier is offering it. If you're 65 after January 1st, 2020, Plan G is the highest level you can purchase. And Plan G is similar to F. The main difference is that Part B deductible, which for 2023 is $226. So in other words, if I had a Plan G, I pay the first $226 on my doctors or labs or anything Part B covers. And after that, everything's covered the rest of the year. Now, there's no drug plan with this type of plan. So you have to then buy a separate standalone Part D drug plan to go with it. So I'm carrying 3 cards with me. I have my Medicare card, my supplement card, and a prescription drug card. Now, there's no networks or referrals. I can go to any doctor willing to see me that accepts Medicare or Medicare assignment. So Medicare is what's called a fee for service, which means it's a little different than most people are used to with normal work insurance that have networks. So just because a doctor signs a Medicare contract, they are not obligated to see you. A doctor can say, I'm not taking any more Medicare patients anytime he or she wants to. So as long as they're willing to see you, though, you can go anywhere. So it's easy from that regard. It's just you're paying more money up front.
Scott, it sounds like it's incredibly important to be, shopping around for that.
Yes.
And
So there's lots of carriers that sell this, because the first thing that comes to mind is say, okay, well, if a Plan G is a Plan G, it's the exact same thing. The private companies are selling it, but the government put the benefits together. Why don't I just get the cheapest one? Well, here's why. Because the prices aren't regulated. They can change the price based on how much claims they're getting in. So this is what's important. This is the number one criteria I use when I choose what carriers I represent. I look at what their increases have been like over time. Now, all of them are going to increase, all of them, no matter what carrier you pick. There's a couple different ways they rate these. Most are age banded, but there's some community banded. We'll take a health of a geographic area, but it doesn't matter. They're all going to increase. So what's important is not what I'm just paying here when I'm 65, what I'm going to be paying when I'm 75 or 85 or 95. How much is that rate going to go up? It tends to be the larger carriers that are more stable, because if I'm a small carrier, say I come into a county, I sign up 300 people, and 1 month I have 10 people run up huge claims, well, I cannot increase the price on those 10. As long as you're paying the premium, coverage is guaranteed. They can't come back to you individually and say, you had a $500,000 hospital bill, Brad, we're going to raise your rate. It has to be the entire pool of people. Where if I have 3,000 or 10,000 people, 10 people is not going to move the needle much. So typically you might pay a little bit more out of the gate, by 10, 15 bucks a month, but over time you will not. And that's the important thing on shopping for a supplement plan. It's not just, let me just go get the cheapest rate because they're all the same. It's what have their increases? What have there been like? And there's no guarantee. I mean, no one can guarantee anything because we don't have a crystal ball. I wish we did. It'd be easy, but the prices will increase over time. So just to give you some idea numbers, I'm making these up. This is not any particular carrier plan, but let's say I paid $150 a month for a plan G. I'm just picking up plan G. Say it was $150 a month. Now that's on top of the $164.90 or whatever I'm paying for Part B, and then I also have the drug plan to it. Well, the average cost of a drug plan is $32 roughly. So let's just round it to 30. So let's say I'm paying $150 for my plan G and $30 a month for my drug plan. That's $180 a month. The good news is with the plan G, I pay the first $226 to my doctors. After that, I don't pay another cent the rest of the year. However, I'm paying $180 a month. That's close to $2,000 a year, whether they go to the doctors or not. So it's costing you something. Even though you're paying less when you go to the doctors, you're paying through it in premiums.
And Scott, oh, I'm sorry, go ahead.
I'm just going to finish my thought. 10 years from now, that same thing is going to be pushing $230 to $240 a month. So it's going to go up. So over a 10-year span, I'm easily going to spend $25,000 to $30,000 worth of premiums. And by the time I'm 85, because the older you get, the increases become, now I'm like $60,000 or $70,000 in premiums over that time. So you follow me? So it's going to be paying them out. So it's cost, even though you're paying less when you go to the doctors, it is still costing you something. You're paying it through premiums.
Yeah, the numbers add up quick. Are you able to change providers, or are you stuck with the provider that you choose out of the gate?
Great question. So on supplement plans, there is no enrollment period. You can change supplement plans anytime you want, but only the first time you select do you get guaranteed issue. So when I'm turning 65, or say I'm 67, I'm leaving the group plan, I still get guaranteed issue. I get the lowest price, whatever carrier I look at. After that, I could change any time. I could say, you know what, I'm healthy now. Let me get a plan A. I just want the cheapest premium. And a year from now, 10 years from now, I can say, I want to get a plan G now. Now I have to go through underwriting. They can pull my medical records. They can charge me more. They can even deny me based on what they find. So it does matter. So even though you can change anytime on a supplement, you have to get through underwriting.
That was my next question, was, are they underwritten? And if they are, how rigorous is that underwriting? How tough is it to qualify?
I don't want to scare people because it's not impossible, but they're looking for more serious things. Of course, if you had a cancer diagnosis, no one's going to write you of pretty much any kind. If you have diabetes or pulmonary disease or cardiovascular disease diagnosed, they're either going to not write you or they're going to upcharge you so much it wouldn't be worth changing. So you have to keep that in the back of your mind when selecting a supplement, like, hey, I might be stuck with this. So what am I comfortable with if something happened to me that I can live with this the rest of my life? That kind of thing.
All right, so what I hear you saying is that while your instinct might be to take the least expensive one right out of the gate that maybe doesn't have the best coverage,
correct,
you need to start thinking about what will you look like in 5 years, 10 years, 15 years.
Correct. You weigh that and without going through all the letters, plan G and plan N are the most popular. Plan N is similar to G. You have to pay the $226, but then you also have a $20 copay at every doctor and a $50 emergency room copay. So, but it might be 30 or 40 bucks a month less. So you can do the math and figure out whether it's worth, but you have to factor all that in when deciding on this type of plan. Exactly.
So here's the other real big, one of the most common questions that we got people sending in ahead of time is, talk about the Medicare supplements versus the Advantage plans.
Very good. So now that we understand supplements, now we can go on to advantage plans, because that is the next option or choice that people have under here. So what this is this is now where, oh yeah, this is where Medicare is paying private insurance companies to manage your Medicare. So with this type of plan, it's as I said, it started in 2006. This is a newer option for people. So the government is now paying a private insurance companies to totally manage your Medicare. So why did the government do this? To try to save money, because the number one cost of the government under Medicare is fraud, waste, and abuse. It's estimated well over $1 billion a year cost. So people say, okay, what does that mean? Well, you hear the term fraud, you think, okay, who's being a crook? And although that's happened, doctors have billed for patients they never saw or tests they never did. It's easy to get away with Medicare because they only have a few claims processing centers throughout the country. If I'm a doctor in Pennsylvania, they're probably processing my claim in Arizona. Other than a number, they don't know who I am. But fraud is the smallest part because most doctors are honest. The biggest part of that is waste and abuse, with waste being the biggest. What that means, it's not necessarily intentional, but I don't know if the audience everyone's experienced this, or Brad, if you experienced this, but if you ever went to get something done and the insurance company wanted a prior authorization, have you heard of that, or anyone's heard of that? So what that is, a lot of people misunderstand, think, oh, the insurance company doesn't want to spend money on me. Well, that's not necessarily true. It's a check on the doctor. The prior authorizations, there's a usual customary path to follow for most things. So they're checking with the doctors. Well, geez, is that test necessary? Or we don't normally do an MRI when we're diagnosing this. Why'd you order one? Now, if he or she, the doctor, has a good reason, they're going to let you get it done. But if they're just saying, I just want to be extra thorough, they're not going to let them add cost to the whole thing just because you could test for everything all day long. Medicare is none of that. They're just paying for every bill that comes into them. So we need to get a handle on this. So they said, we don't have the infrastructure to do this nationally. Why don't we pay private insurance companies that have already been doing this, have been doing this forever, to manage Medicare? That's all this is. So I'm going to way oversimplify the algorithm here, but what Medicare looks at their average cost in every county in the United States. So that's why every county has different plans, because they're paid by Medicare differently in every county. And so carriers are paid by Medicare based on the cost of the average cost in the county that you live in. And that's why they're only 1-year contracts. So they put a plan together. They have to cover everything that Part A and Part B cover. So you're not leaving Medicare. It's all Medicare rules. It's just being administered by a private company. And the October 15th to December 7th, that's the window we're coming up on. That's the window for everyone to pick a plan for next year, because the deck reshuffles. Just because they covered things one way 1 year does not mean they're going to cover it the same way next year. You've got to analyze it and look at it. But because they're paid by Medicare, now you can get a plan that doesn't cost you any premium a month. They have 0 premium plans. People's first reaction is, well, how can they do that? Nothing's free. Well, it isn't free. It's subsidized. They're getting money from the government just by enrolling you. That's how they're able to offer it that low cost. And that's, so the difference is, and by the way, they can include a drug plan in it. So for 0 premium, I'm getting a drug plan and my medical all in one card. So rather than carrying 3 cards with me, I only have 1 card under Medicare Advantage plan. And the Medicare's, it's all Medicare rules. They're paying doctors at the Medicare rate. It's just being managed by a private company. So the benefit to that is purely financial. That's the main benefit. I'm not shelling out premiums whether I go to the doctors or not. I'm paying as I go.
All right. So are these plans underwritten as well?
No. So one of I'll come back to that slide. One of the greatest things, most powerful parts about an Advantage plan is that these are guaranteed issues. So each year when I go to change, there's never any underwriting. So I could, God forbid, develop cancer or something major, and I can change plans, and there's no questions asked.
Interesting. So
you have a lot of flexibility with that.
So what, and I know there's no one answer, it's going to be specific to each individual circumstances, but generally, I mean, what makes sense for who when you're deciding between these two? Are there rules of thumb? Are there starting points for that conversation that you should be thinking about?
That's a great question, and that's obviously what so the answer is it's truly individual. I've had spouses be in different plans. There is no right or wrong. I've had multimillionaires that can afford anything, get 0 premium Advantage plans. I've had people barely afford it, prefer a supplement. They sleep better at night saying, okay, I pay this higher premium, but I don't have to worry about any big costs down the, I pay my Part B deductible $226 this year, and then I don't have to worry about any of the cost after that if I did a G. That's truly an individual choice. So don't misinterpret me. I'm not saying there's no better or worse here. It's just different ways of getting your Medicare. But the biggest, pardon the pun, advantage to an advantage plan is dollars. Because if you go back to a supplement, or say I'm going to spend $25,000 or $30,000 over 10 years in premiums, and if I'm married, that's each. So that'd be double. What's the
Okay.
likelihood I'm going to spend that much in advantage plan? Not very likely. Now, is it possible? Absolutely. I mean, there's no right or wrong. So let me illustrate with an example. It's probably the best way I can explain. I have lots of clients that can pick from. There's one I use because they worked out timing wise. In 2006, I had a couple that the wife went with a Plan F supplement that paid everything. She didn't have any cost out of her pocket as long as it was covered by Medicare. The husband went with a brand new Advantage plan there at that time, 2006, brand new, is healthy, hardly went to the doctors. He said, all right, I don't want to, I'll try that. 10 years later, it's now 2016. I get a call from their daughter. She's upset. Her dad developed cancer, which of course is upsetting. It was May of 2016. I'll never forget. But she was upset because her dad had a little over $4,000 worth of co-payments. He had chemo, he had surgeries, his tests, and at that time, all his co-pays add up to a little over $4,000. Now, all Medicare Advantage plans have a maximum amount of pocket. They have a limit to how much you can spend in a year. At that time, the highest Medicare allowed was $6,700. There were plans that were lower, but that was the highest they allowed, and his plan wasn't that high. So if he hit $6,700 in that year, he's done spending the rest of the year. Still a big number, but the copays don't go on forever. She was really upset because she said her mother went through cancer, didn't pay anything. Why does he have to pay this $4,000? She didn't have to pay anything. After I explained the differences, we went back and added up. Her mother spent $23,000 in premiums in 10 years.
Mm,
Her dad spent nothing. As a matter of fact, he kept track of his visits. He didn't spend $500 in 10 years. He's only with the doctors once or twice a year at $10 or $20 for each time until he got this horrible diagnosis. So now she understands, oh, he's way ahead of the game financially. But now knowing that he's battling cancer, picking a plan for 2017, it's not available today, but at the time it was $50 a month premium, had a max out of pocket of $3,000. So his worst case for 2017 was $3,000. As it actually turned out, he didn't come anywhere near it. He got cancer free. 2018, he went back to a zero premium, which is where he is today. That's the powerful part of Advantage Plan, because you're not deciding what health plan I need the rest of my life. I'm only taking 1 year at a time with the ability to change, guaranteed issue.
interesting. Interesting. And it sounds like the Advantage plans, they work conceptually a little bit like the health insurance that, we're all familiar with through our working years. It's almost like what is available through your company.
Correct. It's very much like that. It has co-pays for everything. But the difference is they are following Medicare rules. So each carrier, they can't decide what they're covering or not. If Part A or Part B of Medicare cover it, they have to cover it. If Medicare doesn't cover it, they're not to cover it. So they're just middle guys. They're operating, so the carrier almost doesn't matter as much because they're all operating the same rules.
So what about things like, I kind of mentioned this or asked this before and we didn't get to it, but things like health savings accounts and what have you, because I know one of the strategies, that, we talk about is, let's, build up that health savings account. If you've got the ability not to use it, you're now creating a little bit of a war chest for post-retirement.
That's a great question. Actually, I'm going to go back to a slide that was skipped over that I want to come back to. HSA rules under Medicare. So, so the first part to your question is, so yes, and if you have an HSA and you have a bunch of money in there, you can use it for whatever the IRS says you can use it for. You can use it actually to pay your premium for a Medicare Advantage plan if you have one, your co-pays for prescriptions, co-pays at doctors. The only thing you cannot use it for is the premium for a supplement. You can't pay if I got a Medicare supplement plan G, I can't use my HSA to pay that, because that's what
But
the
you
private.
could use to pay an Advantage plan premium.
Yes, you can use it for an Advantage plan. I know, just to make things more confusing.
All right.
If I want to come back to this slide for another reason, and that is if somebody's going to work past the age 65 and they're in an HSA, a health savings account, and again, that's where you're putting pre-tax dollars into an account, you and or the company. You do not want to have Part A or Part B, because if you do, any money put in that account is subject to income tax plus a 6% excise tax and whatever amounts put in there. So if I'm going to work past 65 and still keep contributing to my HSA, do not take Part A, even though Part A is free. If you talk to Social Security and say, oh, we'll take it, doesn't cost you anything, they never ask you if you're in an HSA account, and it could mess you up because any money put in there, you now have to pay income tax plus a 6% excise penalty on top.
Interesting. Interesting. And this is something you really need to sit down and think through every single year.
Yes. Yes, this is not just a buy once and be done. Even if you're, especially if you're going to plan to work past 65, you should at least know what the rules are and, develop a plan or what you're expecting to do. Yes, absolutely.
Yeah. And some of it has to do with what your health circumstances are, like in the example you just, gave earlier about the gentleman who had cancer. But I'm assuming there's other financial, um, issues you need to be thinking about too.
Yeah, I mean, so advanced plans, and I'll cover more on cost in just a second, but because I have another slide for that. But it's not like paying more premiums getting me more stuff. It's very specific because it's most things. If we pay more money for something, it's better. This is not the case because advanced plans range in price from zero all the way up to a little over $300 a month. And you think, oh, well, if I get $300 a month plan, I'm getting the best coverage. No, they're designed for very specific things. Those plans usually are covering prescriptions that no other plans are covering. But the hospital copays, the doctor copays are probably higher than the zero premium plans. It's or if you pay a premium, should do something, lower the cost of your medications, lower your max out of pocket because I know I'm going to need lots of services, or maybe you pay a little bit more just in case something that happens. There's always the intangible. So we have the known things and the unknown things, and to try to bring in the cost. But again, the main takeaway is you have flexibility. The main reason to advance plan is you're trying to save money over time, because odds are for most people you will. Now,
It
they're
almost,
also allowed to include other things like dental and vision and gym memberships. And this is what you see on advertised on TV. They always say, hey, do you have dental vision? Because they like getting you focused on that. And although that's all great stuff, you're buying a medical plan. Make sure it suits all your medical and your prescriptions first. And the dental vision is like the icing. If you go into a county like I'll pick a county I'm in, Cumberland County, there's 82 different Medicare Advantage plans. You say, well, how do I pick from that? Well, it's like a puzzle. We start with prescriptions. What carriers have those that least expensive? Then doctors and network would have covering that, and then we look at the dental, vision, and that kind of stuff.
so just out of curiosity, I mean, the one comment you made, it almost seems like if you try to apply logic to it, you're fighting a losing battle. But I like the fact, what you just said makes me think of a weighted matrix. When you're making decisions, you've got all these different boxes, different variables have a different level of importance to them. What are some of the things, and then I'll let you get to some of the cost things you're going to talk about, but what are some of the things that you think maybe people should be weighting a little bit heavier on that weighted matrix?
Yeah, you're absolutely right. Um, so for advanced plans in particular, I mean most of the costs, like doctors are zero to $10 for a primary, 25 to 30 or 40 for a specialist. They'll vary. Hospital stays even are it's a couple $100. The expensive parts of an advanced plan, there's two potential expensive areas. One is skilled nursing or rehab. The first 20 days of all Medicare Advantage plans are at no charge, but days 21 through 100, because remember 100 days as long as you can be in, most of them are a couple $100 per day copay. So if I'm in 100 days of skilled nursing, that's $15,000 while I'm protected by my max out of pocket, which right now is $8,300 is the highest Medicare lets you have for in-network, $11,300 if you go out of network. But anyway, so that's one big potential cost. The other one is Part B drugs. B as in boy. These are not prescriptions. These are things that are doctors are administering, like chemotherapy drugs or anti-rejection drugs or cortisone shots, that kind of stuff. Those are all 20% co-insurance under Medicare Advantage plans, all of them. Now it's 20% of the Medicare rate, not the retail price, but there are some crazy expensive drugs. So those are the really two areas under Advantage plan that's going to really hit potential cost and getting that max out of pocket. Most of the other costs are you're not going to come anywhere near it, which is why I say most people will save money on an Advantage plan over time. Now, there's no guarantee of that. It's just so I've had a lot of clients where they say, well, geez, I'm willing to pay $180 a month for a supplement and a drug plan. Why don't I just take a zero premium Advantage plan? I'll pay myself $180, put that in an account, and I'm saving up. In 10 years, I'm going to have 18, or I'll have all the copay money I need if something bad happened to me.
But like you said, you can also change plans as your circumstances evolve.
Correct. You have the ability to cut down your costs. So, but it's truly an individual choice. Again, I've had, spouses, their family, tree history has a history of, cancer, this, so they're more concerned. They might want to get a supplement because they're worried about something happening sooner to them. They won't have the time to be 75, 85, 90 before something happened to me. So where I've had other people decide, that's why I said individual choice. So what I do is present this to everybody so they can make an educated choice about what's best for them, because there is no one right answer here.
Oh. Is there anything else you want to cover that maybe we've missed from a cost perspective?
Yeah, so real quick, let me just cover the types of advantage plans. Now, again, this is so much cost. There's 5 different types in Pennsylvania. There's HMOs. That's where it's a health maintenance organization. You have a network of doctors. You have to stay within that network. Unless it's an emergency. If you're in an emergency, doesn't matter where you are in this country, they're covered as if they're in network. But if I'm an HMO, I get a serious diagnosis, I'm going to go to Johns Hopkins, say they're out of network, I'm paying full cost. That's where PPOs come in. PPOs, preferred provider organization. They have networks, but they let you go in or out of network. These are by far the most popular because most people like to have freedom. Now, there's not much cost differences between these two. So if you get somebody that says I only use UPMC system, and that's all I'll ever use, then fine, HMOs are fine. But if you want that flexibility, PPO is definitely where you want to go.
And you will pay a little bit more for an out-of-network doctor in
some plans you do, but there are many plans, and depending on central Pennsylvania in particular, but it varies throughout the state. But they have plans that are the same price as any doctor in the country that you want to go to. It's just the difference is if a doctor's not in the network, they're not contractually obligated to see you. They don't have to, but they get paid their same Medicare rate. It's not money, but it's their choice to see you or not.
Interesting.
Then there's private fee for service. I'll skip over that one. Let me get here. And then there's special needs plans. That's where if you're on, there's 4 different types of those. If you're on Medicaid, let me jump to that. If you're on Medicaid, there's dual eligible Medicaid and Medicare for low income. That's where you see a lot of commercials. Get your Part B premium paid for, get all this paid for. It's that demographic of population that qualifies. If you suffer from one of 15 different chronic conditions, they have special needs plans for that population. It makes your medications less money for that. But all these are HMOs, so you got to make sure your doctors are in the network. People live in long-term care facilities or people with end-stage renal disease or kidney dialysis have special needs plans for that population as well that help make those costs with those conditions lower. So again, there's the range of cost for Advantage plan is says 0 to a little over $300 a month, depending on the county you're in. It's not like, I can't tell how many people I've met paying $300 a month thinking they bought the best plan. They never go to the doctors or taking no medications. They are literally throwing their money away. You're not buying more for that. If you pay a premium, it should do something for you. No. Lower the cost of your medications, lower the cost of treatments you're going through, or lower the max out of pocket so you're exposed less or something. But other than that, we usually start at 0. So again, a supplement plan, I'm paying more money up front, have less cost when I go to the doctors. An Advantage plan, I'm paying as little as nothing. I'm paying as I go with a goal of saving money. That's basically the difference in a nutshell. And there's no right or wrong path. Each person's going to answer that differently.
Okay. And Scott, we've gotten a lot of questions, pre-submitted about prescription drug coverage. I know we've touched on some of that as we've gone along. Is there anything maybe we missed or anything that we should?
I'll quickly go through prescription drug coverage because this is also can get very confusing. It can be included in Advantage plan, as I said. If you buy a supplement, you have to buy a separate standalone drug plan to go with it. If you say I don't take any drugs, I don't need a drug plan, well, the government will penalize you for not taking a drug plan when you become eligible for Medicare if you don't take one. And that penalty is calculated on the national average premium, which right now is $30.74. It's 1% of that for every month you go without coverage that you're entitled to have Medicare prescription drug coverage. And so it's roughly 33 cents for every month you go without coverage. So bottom line is you want a drug plan, even if you're not taking prescription drugs, you should get one.
And is that a forever penalty like the other? Oh, yeah,
Yeah,
yeah.
it never goes away unless you qualify low income, then it will. Um, so there's 4 stages to how drug coverage works, and this is all drug coverage, whether it's built into an Advantage plan or you get a standalone drug plan. There's still the 4 stages. Stage 1 is deductible, and by the way, all the numbers I'm showing you are 2023. 2024 numbers are coming out, but this is 2023. The highest deductible can be is $505. I'm going to make a general statement. Most Medicare Advantage plans do not have deductibles. Most standalone drug plans, I'm sorry, do have deductibles. But either way, once you meet your deductible, if your plan doesn't have a deductible, then you go right to stage 2 called initial coverage. So initial coverage is where every carrier puts together what's called a formulary, which is a list of what drugs are covered under that plan. All Medicare says is that best way to think about this is Medicare is a master list of what drugs are allowed to be covered by the carriers. Carriers can't on their own just say, oh, there's a new drug on market, I want to go cover it. If Medicare doesn't approve that drug, they're not allowed to cover it. So a formulary is a subset of what Medicare allows them to cover. So all Medicare says is that every formulary must have at least 2 of every therapeutic category of drugs. So no matter what a doctor's trying to treat you for, there's something in your plan that he or she can prescribe to. But is it the one they want to use? And number 2 is what tier is it in? And by tier, I mean tier 1 is preferred generic, tier 2 is non-preferred generic, tier 3 is preferred brand, then you have non-preferred brand, and tier 5 is specialty drugs. Most plans have 5 tiers. The trick is each carrier can take any drug and put whatever tier they want to. So just because you're taking a generic, a carrier could bill that like a brand, take a branded price like a generic if they want to. This is what trips up most people because you just assume I'm taking all generics. I'll just pick any carrier because it's going to be cheap. Not necessarily. Your combinations, because they might contract for, take blood pressure medications, there's dozens of them. They might pick 5 to 7 that they're going to buy in huge bulk, but you want one of these other ones, or make it a tier 3 at $50 a month or tier 4 at $100 a month to incentivize you to go to the ones that we are buying in bulk. That's how the carriers use this. Now, doctors have no idea when they're treating you, they're just treating you. They don't know what's in your plan or not. So it's on you. If you go to the pharmacy and if they say it's a tier 3 or tier 4 expensive drug, your first question should be, well, what other drugs are in this category? You can go back to your doctor, your pharmacist, say, maybe there's something that isn't a lower tier under your plan. And finally, and a lot of people don't know this, so they end up spending more money than they have to because they don't realize this.
And I assume that involves every year that they're changing the drugs
yeah. Just because it's in one tier 1 year does not mean it's the same tier next year. This is again why you can't just buy this and keep it. You've got to analyze it each year. Also, I know Medicare is tracking how much money is being spent on you each year for medication. If that reached for 2023, if it reaches $4,660, that's the combined amount, how much you're spending plus the insurance company, the total amount. If you reach that, then you enter stage 3, the coverage gap or donut hole people know it by. Because in 2006, when this first started, you hit that magic number, you had to pay 100% of the cost. There's literally a hole in your coverage. Now you have to pay 25% of the negotiated cost. Let me illustrate it because I know this gets confusing.
There was actually a donut hole question submitted. This is good.
Yeah. So let's say I'm taking a drug. The carrier negotiated $1,000 a month. They put as a preferred brand, tier 3 preferred brand. I'm paying $50 a month. They're paying $950 a month. The insurance company. There's a lot of drugs like this. Inhalers are a lot of close to this. So I'm paying my 50. They're paying their 950. In my 5th month, because 5 times 1,000 is 5,000. I've crossed the 4,660. Now I have to pay 25%. Well, 25% of 1,000 is $250. So my cost just jumped from $50 a month to $250 a month. I'm going to remain there till either the end of the year because all this is calculated calendar year, January to December 31st. And then after that, it starts all back over again at stage 1. Or if just out of my pocket, not the insurance companies, just me, I spend $7,400, then I get the stage 4, the catastrophic stage, where I'll pay $4.50 for generic, $10.35 for a brand, or 5%, whatever the higher amount is. And there I stay till the end of the year. The only tiny bit of good news here is while I'm paying 25% of the cost, 85% of the cost is credited towards the 7,400. So going back to my example of 1,000, I'm paying 25% or $250 of the 1,000. But 85% or $850 is helping me get toward the $7,400. So here's the thing, people need to memorize this. These numbers change every year. I can calculate it for you. I can tell you if you'd hit it, when you'd hit it. These are all things we can know. The things we can't know is if in the middle of the year, your doctor has a new prescription, that can change this whole thing. And we can't fix it till October 15th to December 7th for next year till we have one of the windows that we can make a change.
All right.
There's
So
no
when you come out of the other side, when you come
Go ahead.
out the other side of the donut hole, can you buy 2 years worth of drugs?
No, yeah, no, unfortunately. No, it's a wish you could. Now next year there is one change I can talk about. They are getting rid of the where the $4.15 or 5%, whatever's greater, it's going to zero. So once you hit that maximum, that true pocket, which is going to 8,000 next year, but once you hit the 8,000, you don't have any cost the rest of the year. These things are changing, and then in 2025, they're supposed to, right now, the law calls for a $2,000 max amount of pocket. So the most you can spend is $2,000. But I take it as we come each year. There's all kinds of things talked about, and whether they hold up or not, we'll find out. But those are the changes next year. Other than that, there's no insurance you can buy to get out of the coverage gap or donut hole. The only way you can get out of it is if you qualify, or of course, if you're only taking generic drugs, you're not going to come anywhere near it. But if you qualify for either extra help from Social Security, this is another thing you see in commercials, they'll cap your costs on generic or brand name drugs. They'll even help with your Part B premium or help with your prescription drug premium. There's also PACE or PACEnet. This is what our state lotteries pay for. You have to be 65 or older. The income, if you're a married couple, if you make $41,500 a year or less, if you're a single, it's $33,500 a year less, you will qualify. They do not look at assets with this. It's strictly income, and they cap your generic at 8 and 15 for a brand, and there's no coverage gap or donut hole for you. Those are the only ways to get out of it.
All right. Well, Scott, I know we're getting here at 1 o'clock, and I know we're going to stick around just for a couple minutes. I know there were a couple questions submitted live that we'll take. But is there anything else that is really important to cover?
Yeah, just this with this last slide is it for me. Actually, it's just you're unique. There is, through this, there is no best. There's no one best. Most people pick plans based on what a friend or relative says, because you're trying to find someone you can trust. Say, oh, what do you have? Okay, I'll just go with that. But most people are spending more as a result, because unless you're taking the exact same prescriptions, live in the same counties, you have different options. Certainly, if you live in different states, and even spouses can be in different plans based on this, and you need to review it yearly. This is the really the takeaway, because it's not just this. I wish it was. I get asked all the time, Scott, you're with all these carriers, who's the best this year? It depends who's in front. There is no one. It depends on that individual person.
Interesting. Good stuff. Let me see here. And your contact information is there, Scott. And I will just say, hopefully people weren't furiously trying to write everything down, because the slides are available, for the taking. But, that's Scott's contact information. And I'm assuming you're happy to chat with anybody with.
Of course, absolutely. Anybody. I'm licensed in 9 states. I'll help anybody anywhere. Again, we skipped over this slide real quick, but my services are free. I don't charge for what I do. I'm paid by whatever carrier if someone enrolls through me. But I help people find what's best for them. If I happen to not be licensed with this right one with them, I will help them get it, because everything's. You're going to see when I do this with Medicare.gov, everything's transparent. They'll see all the plan options, and we narrow it down. Because I'm there not just I see you once, you never see me again, which is what most brokers do. I'm there all year round. If someone has a problem, a question, a bill they don't understand, I'm there to help them with anything. So I'm like a consultant or an advisor. It's not just I sell them a plan and that's it. You never see me again, which is what most brokers do. So I'm there for the long haul.
That's great. So let me see here. There's just a couple of questions. Somebody asked if they have medical dental through Penny, the state system. When they turn 65, do they have the choice of taking Medicare, or can they stay in Penny?
They have to go into Medicare. Penny ends.
This one seems generic enough to answer. If I have A, B, and G, would that be considered, quote, full coverage?
if you have Part A and Part B and a Plan G supplement, then you should have a Plan D prescription drug coverage with
Okay.
that. Because now some people, if say they get their prescriptions from the VA and say they're a veteran, and some people might not get out of drug plan because they're getting all that's okay. I mean, but if you ever, you'll be, yeah, some people will do that. So there are some plans without a reason why you might not get a drug plan. But if you don't have VA, then you should have a drug plan.
Is that the only uniqueness with VA?
Yeah, so you can have a drug plan, VA, and a Medicare plan. And I encourage people that if they even get all their medical from the VA, get a zero premium advantage plan, because you can, if something the VA never covers, you've got coverage, doesn't cost anything to have it.
Okay.
So and you're allowed to have both. Now,
Okay.
if somebody's full retirement from military and has TRICARE for life, don't ever stay on TRICARE. It's better than Medicare. Don't let it, no one should talk them out of leaving TRICARE.
All right. Let's see. I think we might have covered this. Income look back being 2 years. When is the appeal time for exceptions? How long is the process? What happens if the medical review takes longer than when your higher premium starts? I guess what they're getting at, will they refund you? Will they?
Typically, yes, they have actually, even so, if you did nothing and they find out that it was lower, they will actually refund you back to that date. But
Okay.
it depends. I've seen both cases. So to answer your question, when, as soon as you have a tax return showing that you had, like, for example, again, if I was applying right now and they use my 2021 tax return, but I already had a finished 2022 tax return, I could show that if it took me down to another lower right immediately, right out of the gate, and try to get them to charge me higher right from the beginning. So there's no time frame. The forms are on socialsecurity.gov. There's a form you can get from that to file an appeal.
And is the process timely? I mean, I
It
know you can't say how
it
long it lasts,
depends.
but
I've had clients, they do it in a month. I've had clients take a few months, but it's not years. It's not, typically doesn't cross to tax years and stuff like that. Typically, but
all right. And Scott, there's one more. This might be a little too specific, but they write, planning to retire when I'm 70. They've enrolled in Part A at 65. Should they
okay.
get a Part C only? Still working and still have health insurance through their employer.
Right. So you cannot have both. If you do a Medicare Advantage plan, or which is Part C, you can't have that and the work coverage. So it's an either or. Pick
Okay.
one path or the other. Just like you cannot have two drug plans. You can't have a Part D, a drug plan, and a work drug plan. You have to do one or the other. So
Okay.
usually, if anyone wants an analysis done, because it doesn't cost anything, I'm happy to do it for you. I'll help you compare how much you're paying at work. What are they covering at work? What's your max out of pocket work, which is versus what if you went on Medicare? And you can quickly decide, oh yeah, this is better, or this is better. And
Gotcha.
yep.
Gotcha. Well, I think that covers all the questions that came in live. I appreciate everybody's patience. I know we went a little bit over. Um, there's our Q&A session. We do have a webinar coming up end of the month on the orchid culture. I know we've done that before. That was well received. Just, I want to thank everybody for attending. Scott, I really want to thank you for sharing your expertise with us, for taking the time to do that. Please definitely remember to check the downloads. There was a ton of good information in the slides that Scott went through. And I think with that kind of brings us to the end of the webinar. Thanks again to everybody for attending. It was a really good crowd and a really good conversation, Scott. I appreciate it.
Well, thank you for the opportunity, Brad, and everyone, and Haley, everyone who put this together. I really appreciate the opportunity to do this. So thank you.
You're welcome. Goodbye, everybody.